So now please listen here. So regarding first aid, you know what is a first aid? Something that give at first when we have some kind of medical emergency. The first response is normally called as the first aid. And here we will be mainly focusing on what is the importance of first aid, what are the principles to be taken care while we are giving a first aid, and how the emergency care has to be done. That is the main area of this topic. Here you can see that first aid is the immediate care, as I told you, is the first care given to someone injured or ill. For example, a person who is having some kind of burns, we have to give some kind of first aid. Person has a traffic accident, we should give a first aid. Because most of the time, first aid may help to save the life. So it is an immediate care given to someone injured or ill, aimed at preserving the life, that is saving the life. If that first aid has not been given at the right time, that may lead to major complication or even loss of life. Because if there is a loss of blood or blood from the body, if there is no one to take care and stop the bleeding, then that will result in significant loss of blood from the body and finally leading to a situation where the person may die. Preventing the condition from worsening and promoting recovery. So here there is a definition is that first aid is the immediate care given to someone injured or ill and aimed at preserving life, preventing condition from worsening and promoting recovery. So that is how you can explain a first aid. And second point is regarding the emergency care. It involves professional intervention to stabilize a life-threatening situation. For example, if there is a heart attack or something, immediately you may have to need some kind of technique called CPR, cardiopulmonary resuscitation, that is known as CPR. Only a trained person can do that. But if those instruments are not readily available or those technicians are not available, because most of the ambulance people, they know how to do the CPR and other things. And there are different types of ambulance. Some ambulance are all having more sophisticated equipments in them. So they can even monitor the heart and other things. So these are the part which are coming under the emergency care. Now, what are the objectives of, so let's go into the topic in more detail. What are the objectives of first aid? Here there are three objectives are mentioned. We have already discussed that. One is preserving the life, saving the life. Primary goal is to ensure that casualty, the person who has the problem, survives long enough to receive professional medical care. For example, when there is some accident, most of the time there are not so many good hospitals nearby. So in case of major accidents, only major hospitals will be taking the patient. The minor hospitals may not have enough facilities to take care of them. So maybe it takes half an hour, sometimes 1 hour, sometimes more than 1 hour. So during that time, the person should stay in a stable condition until he or she reaches the hospital. That is the primary aim of first aid. Second, prevent worsening of the situation. Minimize the risk of injury or illness getting worse. For example, the person has a fracture, like fracture or hand fracture or fracture of the hips. If we are not taking the person in a stretcher, we are simply taking the person with our arms, then that can lead to more complication. If it is a multiple fracture, sometimes bones may be very sharp, the broken bones may pierce into the flesh. So that kind of problem will be there. So we have to take the person in such a way that the situation of the person may not get worsened. Then promoting recovery, speeding up the healing process and reduce the risk of complication. That is also the third objective of the, for example, in the first sentence itself, all these aspects have been mentioned, and here the same thing has been categorized into three main objectives. Third objective is promoting a faster recovery. A good first aid or an efficient first aid will make the person in a more stable condition so that he may recover more faster. Speed up the healing process and reduce the risk of complication. So that is also an important objective of the first aid. So these are the three primary objectives of first aid. And here there is a thing called ABC. The most essential aspect of first aid is managing life-threatening situation. ABC framework is a widely recognized approach. Here you can see ABC stands A for airway, B for breathing, and C for circulation. So when we discuss first aid, ABC is an important approach that while we are giving first aid. ABC means first thing to observe is to check that airway. Airway means our nose, our mouth, our pharynx. If something is blocking our nose, or something is blocking our mouth, or something is blocking your pharynx, the entry of air into the lungs may not be taking place. And in that situation, the person may not be able to survive more than 5 to 10 minutes. So we have to immediately remove whatever block that has happened inside the mouth. So ensure that airway is open and not blocked by tongue or any other obstruction. Sometimes children may take small balls or other things, and the balls may stuck into the pharynx. Many times we read in newspaper that such incidents are happening. So there are certain techniques by which we can prevent such situation. And so that is regarding the first approach. Check the airway, check the nose, check the mouth, and check the pharynx. Whether all these are in a normal situation. And second aspect is breathing, B for breathing. Check if the person is breathing normally. For example, if you see that a person is lying unconscious, what is the first thing we are checking? Whether the person is breathing, whether his chest is moving up and down. That is the first thing that we are. So if chest is moving up and down, we may be half related. At least we make sure that the person is alive. So check if the person is breathing normally. If they aren't breathing, administer rescue breath or artificial respiration. Sometimes immediately, for example, the person is not able to breathe properly. The most common simple type of artificial respiration is close the nose and breathe into the mouth and blow into the mouth of the person. That is a simple thing that everyone that can do. Close the nose of the person and open the mouth of the patient, and we blow air into the mouth of the person. So this is a very simple type of artificial respiration. In the hospital, they will be giving it through oxygen tubes or other things. So second aspect is that check whether the person is breathing properly. Now third aspect is circulation. Ensure that there is a pulse. For example, the person is unconscious. Now first thing you check that the breathing is normal and there is nothing blocking the mouth or pharynx. Then we have to make sure that his circulatory system is working properly. For then most of the time we can place our finger on our wrist. Then we will be getting a radial pulse, or you can keep it here. Here also there is an artery that will beat very faster and it is more sensitive also. So that way we can get a pulse. And if necessary, perform chest compression. Chest compression is actually a part of CPR that we will be discussing in another class, how CPR will be, because by simply keeping our hands, for example, person is having a heart attack. If we are giving some kind of stimulus to the heart, some kind of mechanical shock or stimulus to the heart, sometimes heart may recover, then start working. So that is the purpose of this chest compression, beating or forcing on the chest. is known as a chest compression. Purpose is if there is some block or other thing, by doing something by beating or pressing the chest of the person, we can make sure that heart again beats or heart again start working. So that is the third aspect known by the name circulation. So airway, breathing and circulation are the three important approaches in ABC. So this is known as ABC care. So first aid is followed by ABC care. Here we will be looking at the airway, breathing and circulation of the person. Then what are the general steps in first aid? First we have to survey the scene, that ensure that area is safe for both rescuer and victim before administering first aid. For example, person is in a fire area. Before you enter into the fireplace or the fire area or the area with the fire, you have to make sure that you have the protective equipment or protective clothing. Otherwise, in their help to in your effort to save the person, you may also die. So this is an important thing. Survey this. That is by surveying the scene. Just check, observe the scene very carefully. What are the dangerous things which are present there? Then only do something, some kind of intervention. So ensure the area is safe, both for the rescuer and for the victim, before administering the first aid. Then immediately call for help, either from fire force or from police. These are the two people whom we can immediately call. Then assess the condition. Assess the condition of the person. If the person is in a very critical situation, we must get the help of an ambulance at the earliest. Also, if there are 2 or 3 people, one person can look at the patient, another can immediately call the police or the fire force or fire ambulance. So that way, even you may get only 1, 2, 3 minutes for that. In that 2, 3 minutes, you have to divide the task and you have to get the professional help as soon as possible. Evaluate the injury and illness, focusing on life-threatening situation first. So, for example, there are different type of people, and some people may need immediate care, even when there are this flooding or other kinds of problem. This is the approach. Evaluate the injury. Those people who need more critical care, they should be taken to the hospital first. Some people may not be requiring so much critical care. They may have only minor problem, which they can be taken to the hospital only at a later time. So this is the known as evaluating the seriousness of the injury. Then administer first aid. Provide care based on the situation, what kind of difficulty or what kind of injury the person has. Monitoring the victim. Continue checking vital signs and condition while waiting for professional help. So during this time, what we can do, we can check the pulse of the patient. We can check the pressure of the patient. If the pressure is going very down, mostly if you are just before the death of the person, you can see that the pressure is falling, suddenly going down. Normally the pressure is around 80, 120. If the pressure is going below 40, then it shows that the person is almost going to die. If the pressure is the 40, 30, 20, that means the pressure. So that way you can assess the situation. So that is so these are the different steps that we are following in the first aid. Then what are the essential first aid techniques? Different types of first aids are there for CPR, choking, bleeding control, shock management, burns, fracture, seizure, poisoning, hypothermia. So different types of first aids are there, and for each one different approaches are there. Then these are some of the important first aid things available, first aid material which are available in the first aid kit. Bandages should be there, sterile gauze should be there, antiseptic wipes should be there, scissors, pain relievers, gloves, CPR, face shield, cold packs, sterile dressing. So if there is a first aid with you at home, then make sure that all these items are there. Then when to seek emergency care, if there is severe bleeding, and if there is a loss of consciousness, if there is chest pain, and if there is difficulty in breathing, if you feel that the person has broken his arms or legs or hips, then also you have to seek emergency care at the earliest. Severe burns are there. Some burns are primary burns, first degree burns, some burns are second degree burns, some burns are third degree burns. So if it is third degree burns, it means more skin damage the skin has taken. Then seizure, it is something that affects the brain. Then poisoning and overdose. So these are some of the situations where emergency care should be made available at the earliest. Then you should have numbers of the people who are giving this emergency care, like police, fire force. Right now we have a number known as 112. That is a common emergency number. If you call that number, they will assist you whether you need police assistance or fire force. So that is the best way to die, because that they will be available. It's a professional team, and they will immediately send the people who are available in that area. Then you have to also share the location and details that with this emergency team. Then whatever instruction they are giving, you have to follow. So one important thing in any life-threatening situation is that how stable you are, how calm you are. In most of the situation, for example, if it is some kind of accident involving your family members, most of the time you will be panic. You will be in panic and maybe doing absolutely stupid things, wrong things that should not be done in such a situation. And that will lead to more complication, even death. And people who always survive an accident are people who remain very stable and balanced. Sometimes even in a traffic accident, sometimes you may get only 1 or 2 seconds, but that seconds can make the difference. So that is why how stable the person is, how cool the person is, how intelligently that person is behaving. That all determine whether person is going to survive or going to die. So that is an important thing. Then stay on the line until instructed to. For example, when you are calling an emergency number like police, they will tell you what you should do during this time, because they have a professional team. They will give you appropriate guidance. So that is what this part is mentioning. Then first aid and emergency care are critical in ensuring safety during the accident and medical emergency, and regularly updating the first aid skills and knowing. For example, in our next class, we will be going into how different types of first aid can be done, and how you can save the life. So these are there are different types of techniques. For each of the different type of techniques, I will explain some of the common type of first aid that is possible. So today we stop here.